All right, now everyone's rolling in.
Hello, everyone. We're just going to give it another minute for people to log on before we get started. Perfect. So we might go ahead and get started. My name is Catherine, and I'm on the GOMI board. We're so happy to have you all here with us today. I also have Leo on the call who's going to help field the Q&A at the end. If you haven't already, you can go ahead and give us a follow on Instagram, or our website is www.gomi.org. We have old recordings of lectures up on the website as well as Q&A. And that's also where you can head to sign up for future talks. So our mission at GOMI is to create an educational platform where interested students and healthcare professionals can explore and interact with wilderness and emergency medicine to showcase the diverse spheres in which physicians and healthcare professionals can make an impact and inspire others to think abstractly about the ways in which we can utilize our careers in healthcare and medicine to increase and create an international community of wilderness medicine enthusiasts and experts committed to promoting a diverse and culturally competent environment. So we have a lot of other great talks that have happened in the past, which you can find the recordings on the website. Lots of other fun talks in the future that we hope you can join in for as well. So what you came for today, Dr. Rowena Christiansen talking on space medicine. So Dr. Christiansen is an Australian physician practicing in pre-hospital emergency care and medicine in extreme and austere environments with a focus on space health. She teaches human physiology and clinical practice within the University of Melbourne Medical School. Rowena is a fellow of the Aerospace Medical Association and of the college at Melbourne University. She's a passionate aerospace medicine advocate and educator, a member of the Australian Space Agency Space Medicine and Life Sciences Technological Advisory Group, and the founder of the Ad Astra Vita project. Rowena is a UNOOSA Space for Women mentor for the 2020 to 2021, and is an ISU alumna and mentor. So please join me in welcoming Dr. Christiansen. The floor is all yours.
Great. Thank you so much, Catherine, for that lovely welcome. It's a great pleasure to be here today to talk to you all wherever you are in the world. And I'm calling in from Melbourne in Australia. So I'll just share my screen. And just to double check, Catherine, is that showing up okay?
Yep, that looks perfect.
Yeah, great, thank you. So today I'm going to give a bit of an eclectic talk, talking about how skills that you learn in environments which are not space, or where you might live in a country where there are not opportunities to have a career path to a space medicine type job. The sort of things that you can do to develop your skills that will make you more competitive in terms of being able to get into aerospace medicine as a career path. So on the top left corner, there's a photo near Alice Springs in Central Australia. And then underneath that, there's a picture of my ski patrol base here in Victoria. And then on the top right corner, there's a picture of the moon, which I took because I love photography, and then a picture of the Earth from space, which I'm sure you're all familiar with. So I'm just going to talk a little bit about my path to space and my medical journey, and then just focus on a few topics to demonstrate how what you do in the wilderness and expedition medicine context can be relevant to space medicine. So I'll talk about mission planning and expedition medicine training, communication and evacuation, how teleconferencing and getting skills in autonomous care can be an analogue for that, developing medical capability and how rural and remote medicine training and pre-hospital medical experience can be useful. Then thinking about surgery and anaesthesia, critical care, how anaesthetics, emergency medicine and resuscitation skills can be useful. Thinking about disasters, it's not something that we like to think about, but certainly there have been a few in the history of the space program, so it's better to be prepared in case it happens again. And also with commercial spaceflight, the possibility of disaster for the individual ordinary people who are taking space flights, and what I've done in terms of aerospace medicine training and a couple of current initiatives that I'm working on. So I think from an early age, I had a lot of influences that led me to space. My grandfather, maternal grandfather, was one of the pioneers of radio in Australia, and he had a telescope and used to take me out into the backyard and show me the planets at night, and I really used to love that. I had family who were farmers in rural Victoria, and I learnt a lot of skills about resilience and creativity and making do with what you have from them. I think I was always a very curious child, as the photos in the middle row will probably show that I didn't necessarily want barriers put in the way of my exploration attempts. And when I was about probably eight years old, my family moved from Victoria to Townsville, which is in the far north of Queensland, and it's a very different environment to what we have in Victoria. So it's very dry for a lot of the year, but then it does have a wet season, which is very hot and humid and tropical. Also, when I was a child, the Apollo era was still going, and I found that incredibly inspirational, the idea of people landing on the moon and walking around. And the TV series Star Trek, and this was actually a large influence because I loved the egalitarian idea that it didn't matter what your gender was, what your racial or cultural background was, that you could all form together into a team and achieve great things in terms of peaceful space exploration. And also found the technology ideas fascinating with the tricorder and medical devices that Mr. Spock and Dr. McCoy used to use. So I decided that I wanted to be an astronaut when I grew up, quite early on. And so I did maths and science at school, did very well, got the best tertiary entrance score, and I had a great plan. I was going to join the Air Force, become a pilot, and then become an astronaut, because I thought that was how things happened. However, when I got to the end of my schooling, I discovered that at that stage, women weren't allowed to join the Air Force and become pilots. We also didn't have a space agency. We didn't get one until July 2018. And when I was about 14 or 15, my dad left the family and moved to the US. And so I begged him to be allowed to come and live with him so I could go to Caltech and then end up being a scientist at JPL. But he didn't agree to that either. So I had multiple roadblocks to my brilliant plan that I was going to be an astronaut. And a career advisor and my mother talked me into deciding to do a joint degree in arts and law. And so I went back down to Victoria to the University of Melbourne and started doing those degrees. But I quickly decided I absolutely hated law. So I trotted down to the medical school and I said, here I am, I got a great tertiary score, I want to do medicine instead. But they said, no, once you've started another course, you can't change. So I couldn't do that either. I had no option but to finish my law degree. But I decided to do a graduate diploma in education in case I ended up doing tertiary teaching, which I have. I was admitted as a lawyer and practiced as a lawyer for a while, and also did a Master of Business Administration. But I always wished I'd done medicine. And one Saturday morning, I was reading the broadsheet newspaper and saw an ad for a new medical graduate course at the University of Melbourne. So I decided to apply, because all these years I'd been wishing I'd done it. I knew I wouldn't forgive myself if I didn't. So I did apply. I did do the GAMSAT exam and I got in, which I was incredibly grateful for. And I always feel it's been an enormous privilege to study medicine. So after my medical degree, I also eventually found out that there was such a thing as aerospace medicine, because I'd written in the yearbook when I got into med school that I wanted to be a doctor on the first mission to Mars, but I had no idea how you would actually go about achieving that. And I did diploma in child health, Master of Emergency Health, which included disaster health and emergency response, and then later a graduate certificate in space studies. And I did spend part of my postgrad training in Melbourne. So I've done a variety of things in Melbourne, including pre-hospital medicine, public health, medical education. I did my internship at the Royal Melbourne Hospital. I've done some paediatrics and obstetrics and gynecology. But I decided to go and get some work experience in rural settings, because I could be close to the mountains and go and enjoy skiing and hiking and those things which are important to me. And I did rural and remote medicine and general practice, as well as emergency medicine and ski fields medicine near one of our main ski resorts at Mansfield and Mount Buller. Did some obstetrics and gynecology in Wangaratta in the north of Victoria, which is also near another set of mountains, and a year of anaesthetics in Shepparton, which is a fruit growing town. So first of all, I'm just going to touch briefly on mission planning, and we always need to mitigate risk, maximise success. And the old saying, those who fail to plan to fail, is very true. And there are a lot of mission planning considerations for space. You have to think about all of the things associated with providing a medical service, looking after people's health and well-being, making sure that they've got good food and exercise and relaxation. You have to select people carefully and think about a personalised risk assessment. And then you have to do a really thorough pre-flight health assessment to make sure they're going to be okay with long duration missions especially, and then regular in-flight monitoring, both physical and psychological well-being. And the medical kit has to be chosen very carefully, and Dr. Ben Easter gave a great talk about this recently. You do need to cover general health issues as well as emergencies, but you also have to be conscious about weight and volume, because you can't take everything that you need. So you need to have a method of optimising your medical kit whilst at the same time minimising weight and volume. So over the years after I graduated, I did quite a few expedition medicine training courses. I did mountain medicine and vertical rescue in Tasmania. I went to Alta in Arctic Norway to do a polar medicine course. I did another snow and ice skills course in Norway. In Nepal, went on a mountain medicine and Everest base camp trek course. Ice climbing in New Zealand, and alpine search and rescue in Australia. I've also worked as an expedition doctor for Outback Australia and a tour around the Scandinavia, Russian and the Baltic. And just a few pictures here from some of my experiences. But this one down the bottom, I just particularly wanted to point out, because this is someone who's just jumped into a freezing river because we had to practice falling through the ice essentially and hauling ourselves out. And you can see the gasp reflex on that person's face. These are just a few other pictures from Norway and from Nepal and New Zealand, and then down the bottom, search and rescue training. There's just one thing here that I did particularly want to point out. That's this one here of me with the sled that says Olympia Parken. That was at Lillehammer in Norway, where they had the Winter Olympics at one stage. And I was persuaded to go down the skeleton track, which is lying on your tummy, going down at about 70 or 80 k's an hour, and you can't really see where you're going. And it was probably the most terrifying thing that I've ever done in my life. So I did live to tell the tale, but I ended up with quite a few bruises. So I think that there's a fine balance between things that might be good to challenge yourself and provide a bit of adrenaline, but also things that are probably a little bit silly if you haven't had the training to do it. But I think we can blame the course organisers for that. Whoops. And these are some pictures from Outback, Australia, and also the tour around Scandinavia and Russia and the Baltic. And I've just included one photo here of one of our famous saltwater crocodiles, which we saw on a boat when we were going past, and he wasn't really too far away, and he really did look very huge and terrifying. And this is the Arctic Circle globe at North Cape. And while we're at sea, we had some very rough days, which actually had storm warnings. So it's really interesting to experience that extremely rough conditions and have to deal with the effect that it had on everybody. And so through all those training courses, I've had experience of being up in the mountains and the issues associated with altitude, being extremely cold conditions, being extremely hot conditions. And so each of those environments in their own way can teach us things about how the human body can react in space. So the next thing I want to touch on briefly is telecommunications and thinking about the communications delay. So there's only a very short communications delay with the ISS and also with the moon, and evacuation is possible within 24 hours from the ISS. Probably take 2 or 3 days from the moon, but completely unrealistic for Mars. So with telemedicine, it's useful for advice and instructions, but it is dependent on a lot of factors like availability of electricity, space weather, and the further you get out, the less real time this is going to be. So it really will have to be used as an adjunct to a largely autonomous expeditionary health service, and astronauts will need to rely on their own knowledge-based training skills, good teamwork and technology. And robotic surgery, everyone gets a little bit excited about that, but that's actually still quite a way off. But it's certainly something that NASA is looking at, and at the moment, the model is probably more just-in-time instructions. So I was thinking about the pandemic and thinking about perhaps the silver lining might be the amount of teleconferencing that we've been doing, and I've ended up doing hundreds of hours of teaching on Zoom. So I think that's given me a really good insight into telemedicine. So I've been teaching medical students, teaching them about medicine, and so I think that's probably an extra useful little skill set that you've kind of accidentally acquired over the pandemic. I've worked with a lot of medical student groups over the years. That's our medical school on the top in the middle. And I really encourage them to maintain their imagination and their creativity, because that's so important for problem solving, and it's going to be absolutely critical for astronauts in space. If you've ever seen the movie Apollo 13, you'll know what I'm talking about. And before the pandemic, I used to give them Lego to play with and invite them to make something that was medical related. And over here you can see one of the wonderful anatomical structures they've created. And I was also able to spend a few years as medical officer at Ormond College, which is the largest residential college at the University of Melbourne. And so I had the experience of looking after a healthy population, which has a lot of similarities to caring for a medical crew on a mission. The astronaut crew on a mission. So medical capability, this is an interesting question. We need to be able to prepare for both emergencies and general health care, but we need to choose wisely. So we need to think about the question, do we take generalists or specialists or both? And Australia actually has quite a unique model. We have a fellowship in rural and remote medicine, which is run through the College of Rural and Remote Medicine, and this model of being a rural generalist. And that's also the type of doctor that gets sent down to Antarctica on the Australian bases there. And it's a model that's been put forward as being very suitable as the type of doctor you would want as a crew medical officer on a space mission. And as I mentioned earlier, I was fortunate to be able to spend some time working in a little country town of 5,000 people and looked after general health issues, emergency issues, people who were in the little bush hospitals. So it was very broad base of experience. And I was also able to go up to Mount Buller and work there as well and do some ski fields medicine in the clinic there. And some of the mountains are a little bit better than others. Mount Buller actually has an ambulance station as well as a medical clinic and ski patrol, but a lot of smaller mountains don't have a medical clinic or an ambulance service, so it comes back on the ski patrollers. And sometimes you can be waiting up to 4 hours to evacuate someone. So you do really be able to look after someone who's unwell for an extended period of time. And that also has similarities with what might be encountered on a space mission on another planetary body or indeed inside a space vessel. And I also decided to go out and get experience with pre-hospital medicine because I thought that would be another good analogue for space, that you're in an unfamiliar environment, you're having to make do with what you have, and you may end up having some extremely unwell people. One example was a professional cyclist who developed conscious ventricular tachycardia. We had to look after him by the side of the road. And also I went to some music festivals as part of the medical team, and people who take drug overdoses and can be extremely unwell. And I've spent quite a lot of time over the years volunteering with Ski Patrol, and I ended up as the head of the medical advisory committee for Ski Patrol. And you can see from this photo down the bottom here that we really have quite minimal resources in our ski patrol bay, but we nevertheless have to do our best to look after people and stabilise them, and then keep looking after them while we're waiting for transport. And in emergency medicine, pre-hospital medicine, space training, scenario rehearsal is extremely important. And in the bottom corner here, there's an example of an outdoor scenario that we did with Ski Patrol one day. And so another issue people get really interested about. And gravity, the elephant in the room, is definitely a big issue as far as that's concerned. And of course, we have a lovely 1G environment on Earth, which we've all become very used to and is very useful in many different ways. But the moon only has 1/6 of the Earth's gravity, and the moon and Mars only 1/3. And so you've not only got these different gravitational environments, but you've got the issue of people going between gravitational environments as well. And so that throws up all sorts of challenges. But specifically relating to surgery, there are some differences in how liquids behave in microgravity, that venous blood adheres to a local surface due to surface tensions, which can cause problems in keeping the surgical field clean, but arterial blood will spurt out and form droplets, which, as you can imagine, can cause all sorts of problems, as well as contamination. And bacteria float around in the air rather than settling. So that's another issue relating to contamination. And of course, we don't know what new pathogens we might find out there. And bacteria and viruses, when combined with the immunodeficiency you get in space, have been shown to become a little bit more virulent in space, which is really interesting. And surgery in space is still so problematic that we really do need to have a bit of a rethink about whether surgery is actually necessary and whether we do have another alternative that we could do instead. So, for instance, IV antibiotics for suspected acute appendicitis. And with anaesthesia, you can't really use inhaled anaesthetics because you're in a closed environment and you don't want to put everybody to sleep. And also with the changes in cardiovascular physiology, you get the shift of fluids from the periphery to the top half of the body. And there are a couple of other changes which can potentially contribute to problems for anaesthesia. So there's quite a lot to think about there as well. However, one of the things that I always like to stress is that there are a lot of parallels between space medicine and pre-hospital medicine, wilderness medicine, medicine in austere environments, war zones, disaster medicine. So lessons from pre-hospital medicine, especially the use of ketamine, have been thought to be potentially very useful. And where possible, the idea of using regional anaesthesia rather than general anaesthesia, wherever that's practical, and using a muscle relaxant that you can reverse easily, and considering intraosseous access as an alternative to peripheral cannulas, particularly in the cases of shocks. So you'll, if you haven't already, you'll probably all get a chance to learn to do that as part of your medical school training. So I spent a year doing GP anaesthetics in Shepparton, which I really enjoyed. I've also been a representative on the Australian Resuscitation Council for quite a few years, and as a result of that, I've ended up doing quite a lot of resuscitation teaching for basic and advanced life support and paediatric life support, and also made a point of trying to keep my emergency skills up to date by attending courses. And just this photo here, we do have one hyperbaric chamber in Melbourne, but the only other one that I'm aware of in Australia in a public hospital is down in Hobart. And resuscitation in space is also potentially really challenging. So you can't do CPR in the normal way because of the problems of for every action there is an equal and opposite reaction, and trying to keep the resuscitator and the patient together is actually quite complicated. So there's been quite a lot of research about the best way to do CPR, and these illustrations show some of the alternative methods they've come up with. And in this particular study, the handstand method, the one at the top, was thought probably to be the best one. And I'm just going to talk a little bit about risks now, particularly in relation to commercial spaceflight and the idea of preparing to avoid disaster and enhance safety. So there's always going to be potential for disaster with human spaceflight. There have been a number of crashes and explosions and loss of life. Of course, all of that has been incredibly tragic, but it's also something that we have to be realistic about, and the potential that it could happen again, because unpredictable things happen. If you look at the human space flight safety record, it's really not too bad in comparison to the risk of dying from a motor vehicle crash, which is somewhat reassuring, but those numbers will change, no doubt, as more suborbital flights take place. Also, a lot of spaceports around the world, more and more developing all the time. So where there's spaceports, there's always going to be a risk. And the reason for that is that there's going to be a lot of people within a focused geographical area when commercial space flights are involved. There'll be people gathering to watch launches and cheer on their loved ones. There's going to be large quantities of flammable fuel and other chemicals. And so there's going to be an ongoing risk of mass casualty incidents resulting from this combination of rocketry fuel, spacecraft, and mass gatherings. So spaceports are going to need really good emergency management plans. A lot of them are going to be in remote areas that are far away from major hospitals and trauma centres. So you're going to need a really good emergency response plan to prepare for the possibility of mass casualty incidents. So you need people who have skills in order to be able to do that. And when I did my Master of Emergency Health with a focus on disaster health and emergency response, within a couple of years after that, I became a director of the World Organization for Disaster and Emergency Medicine, also known as WADM, and I was the director for 6 years, which is an enormous privilege. And a couple of years ago, the WADM conference was in Brisbane here in Australia. So I actually gave my commercial spaceflight presentation and a presentation about clinical challenges for medicine in spaceflight. Australia is a very large continent, but it's also very frequently touched by disasters. So with the exception of the aerial shot of the cyclone, all these other photos are my own photos. So I have experienced all these disasters myself at various times. So we had floods. When I was a child, we had tropical cyclone Althea, which came through and devastated Townsville where I was living. A few years back, there were some really devastating bushfires which destroyed all the snow gum forests around the ski resorts in Victoria. So there are a couple of shots there of the blackened forests. And when the trees are burnt and dead, you actually have to cut down the ones which are close to paths and trails, because otherwise the limbs can fall off and cause injury to people. And bushfires, when I was living in Mansfield, these devastating bushfires came very, very close. You can see some pictures of the smoke that was close to where I live. And also drought. Drought is a very common thing in Australia. So learning about disasters can give you enormous insight, both into how to handle them, but also how to look after the people, because there's always going to be repairing the infrastructure and the landscape, but looking after the people is something that's really important. And the last thing that I'm going to talk about, after I just have a sip of water, excuse me, is thinking about commercial spaceflight from the individual perspective. So we're going to need good spacecraft design to make these spacecraft safe because they have to resist high G-forces and extreme high altitude, 100 Ks up, low barometric pressure, extreme cold, and virtual absence of oxygen. So all of those things are not very good for survival. And we need very highly trained pilots, and we know that professional astronauts spend many years training for their missions. So we would be hoping that the pilots who are flying people into space would have an equally long apprenticeship and experience. So passengers themselves will need to be suitably trained, suitably dressed, and protected from the environment. And a point that people don't often talk about is that ordinary people are going to need to be able to cope with both the anxiety and psychological stress of spaceflight, in addition to the physiological stresses, such as the increased G-forces. And at the moment, there's a little bit of a gap between where things are at with entrepreneurship and organisations like Virgin Galactic and Blue Origin and government regulation. And at the moment, the US FAA requirements are fairly minimalistic in terms of spaceflight participant training, basically saying you just need to know how to respond to emergency situations. So it's been hard to find too much about the training programs for both Virgin and Blue Origin, but they seem to be making it comprehensive in terms of preparation of people to actually know their way around the spacecraft and to have some familiarity with what's going to happen. But 3 days and 2 days, it's really not very long. So you certainly would have a concern about assessing people's response to training and if they're really good to go. And there's also the issue of medical fitness, which I'm not going to go into because that's a whole topic on itself. But that's going to be really important because we want to strike a balance between ordinary people being able to fly to space, but at the same time, we don't want ordinary people with serious medical conditions that might cause them to become extremely unwell or die in the middle of a space flight. So parabolic flight actually has quite strict requirements, and people need to go and get an aerospace medical and an ECG before they fly. And I'm sure that similar requirements will be developed for commercial space flight. There's a lot of discussion about that at the moment. So these are just a few of the things I've done in aerospace medicine. I've had a lot of fun doing courses, flying flight simulators, including the Boeing 737. And I've volunteered with a lot of organisations within the Aerospace Medical Association, including a couple of years as chair of the Associate Fellows Group. And back in 2020, I was extremely honoured to be made a Fellow of the Aerospace Medical Association. And I've made so many wonderful friends and colleagues through my involvement with that organisation. So I can really highly recommend that. And particularly for those of you who are students and residents, AMSRA, the Students and Residents Organisation. I also was very lucky earlier this year to be able to go to the ESA Space Physician Training course, which was a wonderful experience. And back in 2016, I went to the International Space University program in South Australia and learned all about the space sector. Also went to the first Humans in Space course that year, and started presenting at conferences on space-related topics, which I've kept doing ever since then. And just down the bottom, I put this screenshot of Air Crash Investigations because it's actually one of my favourite TV programs, because you learn so much about how aircraft operate and human factors. So that's a form of learning that's completely cost-free for you. And just one little teaser. So there's a lot of talk about humans becoming a multiplanetary species. And so if we look beyond the horizon and start to contemplate human families in space, we're going to once again think about medical care, and obstetrics and pediatrics need specialised knowledge. So we're going to need doctors who can look after those sort of problems. And pregnancy and childbirth in space also, will humans evolve into a slightly different type of human if you spend your whole life living in a different gravitational environment? And also there's an ethical or human rights issue about the rights of the child, because here on Earth we give children a whole panel of rights which we should aim to provide to them. But taking children into space, which is an extremely hostile and dangerous environment, is a whole thing again. So on Mars, there's basically a poisonous atmosphere, very high radiation. And radiation is particularly concerning for children, because ionizing radiation is a known carcinogen, and fetuses are probably particularly sensitive to ionizing radiation. So we really need to think about the ethical issues associated with this, and whether we can actually adequately protect children from that risk. And also something I like to wonder about is whether children will actually be able to grow and develop properly in a microgravity environment, because we've evolved here on Earth, and so many things that children learn to do, especially when they're young, are dependent on gravity. So things like rolling over, starting to crawl, starting to stand up, starting to walk. And also muscle and bone strength also is dependent on gravity to a high degree. And we know that muscles and bones actually degenerate in space. So what's this going to do in terms of child growth and development? So just, I did have a, whoops, sorry, I just had a conclusion slide, which there we go. So my conclusions for you today are: nothing you ever do in medicine is wasted. Look out for opportunities, be proactive and challenge yourself. Think about giving back through volunteering to help others, gain more experience and grow your networks. And use your creativity and imagination to think about how your skills and experience can be applied to your passion area. Teaching is a great way to maintain your knowledge base and skills. Always maintain good relationship with mentors and networks. Never stop learning. And finally, risk is something we never should be nor can be complacent about. To quote the Spanish philosopher George Santayana, those who cannot remember the past are condemned to repeat it. And just finally, a couple of things that I'm working on at the moment. The Ad Astra Vita project, and also the Australian Space Biology and Health Summit. And I thought I would finish with some pictures of some cute Australian animals for you. Thank you very much.
Thank you so much, Dr. Christiansen. And I love the cute Australian animals at the end. Always a fun addition. I might pass it over to Leo to head the Q&A, but if anyone has any questions for Dr. Christiansen, feel free to throw them in the chat.
Yeah, so one of the questions we received was from Shilpi, actually. And that was, do you think the pandemic has inadvertently helped push forward the capabilities of telemedicine with regards to space medicine?
Thanks, Shilpi. Yes, I do think that the pandemic has pushed forward telemedicine. For instance, in Australia, there's been a very widespread adoption of telemedicine to look after people in both rural and remote areas, but also people in metropolitan areas, because, for instance, here in Melbourne, we're now the most locked down city in the world ever. So people haven't been able to go and see their general practitioner. And so telemedicine has been adopted as a way of getting around the issue of people letting go of their health problems during the pandemic. And the Australian Antarctic Division actually has really advanced telemedicine capabilities. It's probably amongst a world leader. And I think what's happened during the pandemic has certainly helped them to develop that further. And they're certainly talking to NASA about all that kind of stuff at the moment.
Thank you. Next, we have a question. Do you have any specific advice you would give to medical students or people earlier in their career that are interested in space medicine?
I guess it depends a little bit where you live. If you live in the US, there are going to be more opportunities which are open to you. Lots of universities have space medicine chapters, and if you look on social media, there are space medicine talks being advertised all the time. I can strongly recommend getting involved with the Aerospace Medicine Association, AMSRO, the Students and Residents Organisation. They also run lots of webinars. They have a session at the yearly asthma conference. And I think that just apart from generally being on the lookout for opportunities, just to think about those skills that do make a good space medicine doctor or a good expeditionary doctor, and be working on developing those. So if you do get the opportunity to apply for something concrete, like an internship with NASA, or Shilpi's been on the fellowship with SpaceX, that you have things in your CV that you can point to and a resume and say, you know, I've done this and I've done that and the other thing, and this really relates to space medicine because, and part of the point of showing all the things that I'd done was not to say, look at me, I'm great, but just to show that through doing this wide variety of things, that you really can acquire quite a substantial toolkit of skills, which is very relevant to space medicine, and you're going to be much better off than somebody who's just gone, oh, I'd love to be a space doctor, but hasn't actually done any of these things. So, and I think also volunteering with aerospace medicine organisations, like AMSRO is a good example, but there are plenty of other organisations and committees within the Aerospace Medical Association. Volunteering with those means that people get to know you, you get to build up networks, and people start to take notice of you. And so all of those things are really, really valuable. There's also plenty of free stuff online you can look at, like the Ad Astra Vita project website has heaps of resources on it, lots of recordings of free webinars and links to educational courses. And of course, the GOMI website is a treasure trove of information and presentations. So there's plenty of stuff out there. I think it's sort of one of those things where if you just kind of make it a project one day, just to have a bit of a look around what in your area you might be able to get involved with, what's available online, and then make a bit of a plan. I think you'll find there are plenty of resources that you can get hold of and get involved with.
Thank you, that was wonderful. Next, we have a question from Badr Ali. He was wondering, from your opinion, do you think it makes more sense to potentially send a medical doctor with each spaceflight, or instead train astronauts basic medical care?
I think probably the most sensible thing is going to be to do a combination of the two. So if there's the mission to Mars, there's probably going to be 6 or 8 people. So especially for such a long duration mission, I think it would be important to send someone who's actually a trained medical doctor, but it would also be really important to train up the other crew members in basic medical care. So they're a bit like an advanced first responder, because the doctor might get injured, and what happens if the doctor gets injured or gets incapacitated? And the Australian Antarctic Program, once again, has this thing called lay surgical assistants, and they actually train the tradespeople going down to Antarctica, like the electricians and plumbers and scientists, to be assistants who can help while the doctor's doing surgery. They can help to administer the anaesthetic and monitor the patient and that sort of thing. So I think everyone is going to need at least a sort of advanced first responder capability, as well as having a fairly broadly skilled medical doctor.
Thank you. And I think we have our last question from the chat, which is from Malcolm Tran, and they're wondering, with all the talk of sending humans to Mars, how feasible of an idea is that? Do you think this generation will see the first humans on Mars?
To answer the first part of the question, yes, I think you're all still young enough that you will definitely see humans on Mars, but we're not there yet. There are a lot of problems which still need to be addressed. Radiation being a really significant one, and working out the sort of best way to shield the astronauts from the effects of radiation. And there are still quite a few other unknowns which need to be addressed, and part of that goes back to what I was talking about earlier with the transition between gravitational environments. And so we know how people adapt to microgravity. We've had people on 6-month or even 12-month missions on the International Space Station, but we know often when they come back to Earth that they have the orthostatic hypotension and they can't actually stand up by themselves straight away. And so we're going to have astronauts who've been in microgravity for 6 to 8 months who are then transitioning to a partial gravity environment, and nobody's actually done that before. So sort of how astronauts are going to react to that, and making sure that they're going to be capable of landing the spacecraft safely when they get to Mars, and B, actually getting out and going around Mars without injuring themselves. So that's one of the other issues. And all the life support aspects as well. There's a lot of work that needs to go into that, because you basically have to do advanced supply missions to Mars to make sure some stuff's there already, and then you take what you take, and that's all you've got. There'll be no resupply. Once you set up for Mars, there's no turning back. So you have to make sure that you get that balance right of what you're going to take with you in terms of things like medical supplies, nutrition, well-being. And so they're still working all of that out, and just the things like making sure all the rocketry is working properly, and you can be able to lift the amount of stuff that you need into orbit. And so there are a lot of problems that still need to be addressed, but people are working very hard on them, and I think there's definitely a strong will to solve all these problems. So I'm sure that your generation will definitely see the first humans on Mars. I don't know when, but you've all got long lives ahead of you, so I'm sure it'll happen.
Perfect.
Thank you.
Well, thank you once again so much for joining us today, Dr. Christiansen, and thank you for everyone else for hopping on the call. We hope to see you next week for Envenomations.
Thank you. It's been a real pleasure being with you today. Thank you very much for the invitation, and good to see you all.